Propecia, the best treatment options. Male pattern baldness is the common type of hair loss that develops in many men at some stage. The condition is sometimes called androgenetic alopecia. It is caused by a combination of hereditary, genetic, and hormonal factors. Hair is made in hair follicles. A hair normally grows from each hair follicle for about 3 years. It is then shed and a new hair grows from the follicle. As balding develops, affected hair follicles gradually become smaller than normal. Each new hair that grows is thinner and shed more quickly than before. This eventually leads to a much smaller hair follicle and a thin hair that does not grow out to the skin surface. Male hormones are involved in causing these changes. Hair follicles convert testosterone, the main male hormone, into another hormone called dihydrotestosterone. Affected hair follicles become more sensitive to dihydrotestosterone, and this causes the hair follicles to shrink. For some men, this normal aging process can be distressing, particularly if it is excessive or occurs early in life. Treatment with finasteride can help prevent further hair loss. It works by stopping the conversion of testosterone to dihydrotestosterone. Finasteride is only available on a prescription from a doctor, but it is not available on the NHS. This means you will be asked to pay the full price of the tablets when you receive your supply. Propecia should never be taken by a woman or a child. Finasteride can be absorbed through the skin, and women or children should not be permitted to handle finasteride tablets. To make sure you can safely take Propecia, if you have any of these other conditions: liver disease, or abnormal liver enzyme tests, prostate cancer, a bladder muscle disorder, stricture of your urethra, if you are unable to urinate, or if you have ever had an allergic reaction to a similar medicine called dutasteride, Avodart. Propecia side effects. Get emergency medical help if you have any of these signs of an allergic reaction: hives, difficulty breathing, swelling of your face, lips, tongue, or throat. If you notice any breast lumps, pain, nipple discharge, or other breast changes, these may be signs of male breast cancer. Less serious Propecia side effects may include impotence, loss of interest in sex, or trouble having an orgasm, abnormal ejaculation, swelling in your hands or feet, swelling or tenderness in your breasts, dizziness, weakness, feeling like you might pass out, headache, runny nose, or skin rash. The sexual side effects of Propecia may continue after you stop taking this medication. Effects on body hair. When finasteride is used to regrow scalp hair, it may also inhibit the growth of body hair. The reason is that DHT stimulates the growth of body hair in adult males, and the formation of DHT is blocked by finasteride. Treatment. Conventional therapies. Many studies have looked at male, female pattern baldness, and there is substantial evidence supporting the efficacy of topical minoxidil and finasteride. Topical minoxidil, 2% and 5%, and finasteride are the only FDA-approved treatments for male pattern hair loss in men over 18 years. Topical minoxidil 2% is the only FDA-approved treatment for female pattern hair loss in women older than 18 years. Finasteride, Propecia. This prescription medication is FDA-approved to treat male pattern baldness in men over 18 years, and is available in 1 mg tablets to be taken once daily. Finasteride works by blocking the conversion of testosterone into DHT. Many men taking finasteride experience a slowing of hair loss, and some may experience some new hair growth. Alternative approaches. Light therapy. These handheld devices are available without a prescription and are often acquired via the internet or infomercials. They are advertised as being a painless treatment. Hypnotherapy, not helpful for pattern hair loss. A simple internet search for hair loss and alternative treatment will result in many hits for hypnotherapy. It's too bad that this safe and effective option has no evidence to support its use for pattern hair loss. Omega-3 fatty acids. For overall health reasons, especially in terms of cardiovascular and neurologic function, it is wise to encourage your patients to include foods with a high amount of omega-3 fatty acids in their daily diets, such as fatty cold water fish. Herbs and vitamins. Various herbs and vitamins, aloe vera, stinging nettle, red pepper, green tea, donkey, biotin, are promoted as helping with hair loss. But, there is no data on any of these compounds to support their use in the treatment of pattern hair loss for men or women.